In this video, I'm going to show you an interview I did with Dr. Tom Giammatteo. It's very powerful, and it's about myofascial mapping. Now, when you're dealing with a chronic condition, autoimmune condition, high anxiety, chronic pain, if it's not healing, if for some reason it's just not healing despite a lot of really good treatment, there could be a very important reason. And one is that you're doing your treatment in a place that's not optimal. The key is to find out, why is somebody not healing? And what we found is that it's because you're protecting something very important to you. And when you look and find what you're protecting yourself from and help the body heal that, we can see profound changes. So I'm going to play this video because it's so important. And I meant to record it. It's on our Facebook, but I want it on our YouTube because it's really important to see how to find and heal up the area of the body that's that you're protecting yourself from, so you can get your health back, whether you're dealing with a chronic illness, autoimmune conditions, high anxiety conditions, chronic pain. This can help. This is what I've been using since February of 2000, and I'm going to show you that now. Enjoy. So people can find us. So it might be a good thing to share with the IMT community, to let them know you're doing stuff about it, about IMT and getting this message out. So I'll send you the links in your inbox. So all right, everybody. So I'm super excited to do this for you. My name is Ralph Havens, physical therapist and integrative manual therapist. This is Dr. Tom Giammatteo, longtime friend, colleague, teacher, mentor, chiropractor, naturopath, acupuncturist, PT, and developer of integrative manual therapy. And I want to talk about something that that really influenced me when I first met Tom and the late Sharon Giammatteo, February of 2000, because they could see things. And by that, I mean, I was sitting at a table, and from across the room, they could see what was going on with my physical body, and then let me know what technique to use from the class I was taking, the first integrative manual therapy class I ever took. And then we did the techniques with our partner. I had my therapist there working with me, and she worked on me and I worked on her, and we improved in our physical bodies. And sometime after that, I remember I couldn't run. I had a problem, something right around that same time. And I went about 8 months, forgot the exact timeline with this, but 8 months of not being able to run. And I went to a therapist in Los Angeles, Julie Cicino, who was trained in integrative manual therapy. And she put one hand on my foot and said, "You have a problem with your heart." And she worked on me for 2 hours. And I went for a run 2 days later after 8 months of not being able to run, and I was able to run. So she worked on my heart, but she could see it from just touching my foot. And then I had a client. I'm telling you these stories to let you know that there's a way to find out how to help somebody heal. And I had a client who came to see me after 2 years of having severe headaches and neck pain and back pain after a car wreck. And when I did it's called myofascial mapping, my assessment, I found grief and sadness and despair, deep sadness, in your lungs. So there's a technique. I didn't do talk therapy, but there's a technique called the blueprint. I did a few of these blueprints to clear that. And her headaches and neck pain and back pain went away. And she asked me the second session, like, "Well, what did you do? Because this is actually helping." And after 2 years, and so I told her, and then she told me who had died in her life and what had happened. And so her body was protecting her from the deep spiritual pain. And so there's this thing called myofascial mapping that we use to find what's going on. And it's so important because it's like, take for example, a cut that heals. That's a miracle, right? Healing is a miracle. If it doesn't heal, why is that? Why are the stitches not working or the bandage not working? Why is it going for weeks without healing? If it's infected, you might need to do something to get rid of the infection. In the medical world, it would be antibiotics. If they're diabetic and their blood sugar is out of control, you got to do something to get their blood sugar under control, the diet, or maybe there's medication for that. But and then it heals naturally. And once it heals, there's no reason for the cut to come back. And so the idea is to find out, like, well, where is this place that you need to work? You need to do your treatment to help somebody heal. And I think a lot of people are, we all have our different skills, whatever your skill level is, if you're a practitioner, and it helps us find where to go look. But if you're looking in the wrong spot, it could be a real, tough way to go. Like it just keeps coming back or it doesn't totally go away. But if you're looking in the right place, it can make all the difference in the world. So I want to ask Dr. Tom Giammatteo, about myofascial mapping and how it came to be, and just anything else you want to share about this way of finding where to do your healing work. So thank you, Tom, for being here.
So thank you, Ralph. Well, the Connecticut School of Integrative Manual Therapy has been around for 21 years now, and we're recognized by the state as a new occupation of integrative manual therapy. So my wife Sharon and I have been doing this for over 45 years, and yes, she did pass 7 years ago. And one of the keystones to the implementation of integrative manual therapy is knowing where you want to work. And so in the early days, we were doing other diagnostic tools. One of them was cranial sacral rhythm, invented by the osteopaths, and cranial work. And then there's Reiki, and then there's also people that can read auras off the body. They see them, type of thing. So a mixture of studying a little bit of those things and starting to feel this really interesting connection in the tissue. So everybody has felt myofascial mapping pieces in the body. The best way I could describe it is that when you're going to grab your buddy's shoulders and you just want to give them a nice shoulder rub from behind, and you notice that one side is a little bit harder than the other, or the muscles don't work as well, or it's really stiff, and you can feel that. That is a partial mapping of the body. And we just really defined it that there are other things going on. If you want to get into the quantum physics of it, the chondroitin and glucosamine and chondroitin little fibers that make up the structure of the fascia are inorganic, which means that they don't breathe, they don't die. They're strands of tissues. They actually have little flagella on them, which are little tails. And if everybody's happy, they all wave in the same direction. So it's almost like going underwater and seeing seaweed, and they all do a nice dance to the left and right. And, imagine if a boat comes by and all the seaweed starts to swirl up. That's what we feel with our fingers in the myofascial mapping.
That's a great description.
And there's many videos showing, one is called Trolling Under the Skin, where they actually take a little camera and you actually see the architecture of these fibrils. In real life, I can say that those fibrils are in every day. If you have a piece of raw chicken breast and you see a glob of white fat on it, if you try to pull the fat off, you see this translucent or creamy or see-through tissue underneath, and that's the fascia. And it actually has its own pulse and its own rhythm. And this weekend, Ralph, we're doing cranial 1 and 2 of the school, and we're actually examining all these different pulses. Just like, you can feel your heart pulse, you can measure your lungs, you can take your pulse in your neck, and there are other rhythms not so familiar or been forgotten about, actually, from the community that wants to cut it or snip it or just put drugs into it. But we really find that palpation skill. So another way is, if you cut your finger, if you really look at it, if you put your hand on the finger, it will be a lot warmer, maybe a little moister. And if you really start to glide it back and forth, it's stiff in those areas. And that's what we call myofascial mapping. And it was a mixture of talking about the cranial sacral rhythm and the visceral rhythms and the heart rate and the breathing rhythms, which have been in chiropractic and osteopathic philosophy for 100 years, and in Chinese medicine for 6,000 years. So it's nothing new, but it wasn't in the box of what we call Western medicine's belief systems. And so Sharon was finding this rhythm that she thought was craniosacral, and then she went to advanced course with Dr. Upledger, And she said, see, I feel it here. See, I feel it here. See, I feel it here. And he goes, well, that's not the cranial rhythm. I'm not sure what you got, but it seems interesting. So why don't you go study it more? And that was the evolution of myofascial mapping.
And then she found the difference between like it doing this versus it doing something else.
Yeah. So we came up with different definitions in there. But truthfully, the myofascial mapping, which makes, I feel, integrated manual therapy light years ahead of everybody else, because it gives you an instant process of seeing where the body is tight. And if you fix it correctly, the map changes immediately.
Yeah,
Right.
yeah, that's what I saw with that one lady. And it was, there's a way to check, is it a spiritual pain versus is it a physical thing? And I saw that. And then with the little boy that came to see me after a trampoline accident, he, I saw some ligament stuff, but we kept testing him before and after. And,
Yeah.
and then it was like, oh, there's just there's a bone bruise where that ligament is. And there was the mapping for that. And I did the technique that you showed me to fix up the bone bruise. And he stood up, he smiled, he started walking on his foot, and he said, can I run? And his mom was like, not yet. And he was good with one, it was like, it wasn't, it was a specific mapping that said, this is a bone. And the other lady, it was a specific mapping that this is a spiritual pain. Right. And it's just interesting how you guys were able to discern the difference between those kind of things.
It's part of the first year of the class coming in September. The second weekend in September, we're teaching myofascial release, and then 4 days of learning how to do this map.
Okay, and imtwellnesscenter.com is how to find that. Yep. Okay, yeah. So September, teaching myofascial mapping.
Yeah, and it is the flagship of what we do. Without
it really
that,
is, because if you're working in the right place, then you got a chance. It's like whatever you're doing, ultrasound or a little massage or just putting your hand on it to like send it love. It's like at least you're in the right place.
Yeah, and so far in my education, and you listed off quite a few degrees, it actually transcends traditional physical therapy, acupuncture, chiropractic, nutrition, even some portions of psychotherapy and hypnotherapy.
Yeah.
When we talk about, if people know about chakras and how they come out of the bodies, and other people talk about auras, thousands of years ago, they have charted out these different relationships. And so we had learned from Jean-Pierre Burrell, who taught visceral manipulation. He would actually, in his second course, have people glide over the body like 1 inch over it, and then 3 inches over it, and then 6 inches over it. And your hands would stop gliding at certain points. And that was a projection of your energy, which is, very esoteric for the community that doesn't see it. But we were getting people profoundly better with those pieces. And we found that we could find the same location of each one of those spots by palpating in different directions. So the first direction is always with my fingers horizontal to the ground. The second direction is the feel spreading. Most of the rhythms keep you parallel, but if you have a split, that actually equals mind and body. Mind and emotions. Mm-hmm. And then the third direction is little speed bumps in that tissue, and that we call spiritual / bone bruises. And it's part of our grounding. It's part of keeping us together. And all those put together and seeing which layer is first, second, and third. Because, sometimes people can't get better unless they let go of their anger. Sometimes they may need some calcium because they're depleted in the structures. Mm-hmm. So that really gives us a clue. But you have to be neutral, and you have to believe your hands. So it's a very big challenge. And even in the senior students that come see me, we always make them map before they start their classes. And people go, well, I don't do that really well. And it's just like, well, you have to be quiet and you have to be a scientist, because it's not you're wrong if it doesn't change. It's like, oh, what else did I forget?
Wrong information. Yeah, and being neutral is key. Like you could map whether or not that first glass of wine is useful. If the fifth glass of wine is useful, it might be you're not so neutral.
Right. And
Yeah.
so it's an elegant technique.
It is
And
beautiful.
when the first class comes on, and it starts September 10th. September 10th, 11th, and 12th are the myofascial releasing class. And we introduce mapping there.
Yeah.
And then the 13th, 14th, 15th, and 16th, we go in and if you don't even think you got it at the beginning, you definitely have it at the
You're gonna
end.
get it. Yeah, it's actually way easier than for me than when I was learning the cranial sacral rhythm. It was like it was way easier to learn it, and that's a lot of time. The 10th, 11th, 12th to learn a myofascial technique that's so powerful and so simple and so elegant and so not trying to force the body. It's really quite interesting how deep you can get into the body with the myofascial technique that you use, because you're not trying to stretch something or force something. You're actually letting the body, it's kind of like having the old telephones with the cord, and if it's all jumbled up, you could hold the phone part of the phone, and then the base would like unravel. It's like just letting the body do what it does without force. It's a really wonderful technique.
And for the people who have a healing art that they've studied for many years, what I tell about integrated manual therapy in the school is we're about 300 practitioners now, about 150 practitioners that share around the world, and we bring in all these new arts and we put it in a common terminology. Because
Yeah.
if somebody's been a body worker, a massage therapist, or has this intuition, they probably know about 10% or 80% of what we teach, but it's just in an organized fashion that you can communicate it to other people and it can move back and forth.
Mhm.
And, nothing is really new. It's been there for thousands of years, and it's a life truth, basically.
And what
But
it is, what I find is it's an overall framework. Like when I first took integrated manual therapy, I thought I had it figured out, but it was so like complicated because I had, am I doing a cranial sacral assessment? Am I doing a visceral manipulation assessment, a mechanical link assessment? I've got functional orthopedics, the structural integration. I've got a Feldenkrais kind of way of looking at things. It's like a client would come in with a complex problem, a long-standing problem, and it's like, okay, which way am I going? Integrated manual therapy gave me the overall, like, okay, where's the primary problem? What is it? And then you can decide, is this going to be a cranial work thing or a visceral thing? But it's like instead of having so many tools just all over the garage, it's like I had a one diagnostic way to kind of get in the zone and what is it, where is it, what's the best thing to use.
So the highlight of today was we had a person 6 weeks ago was on a 20-foot ladder, and it slipped, and so she fell with the ladder and landed on her fist.
Ooh.
And hasn't been successfully getting better. So this was the first day in my office today, and we have the cranial students here, which are 2/3 of the way through the program. So they know how to map and everything. And we did a detail map, and she went to the orthopedist and said, my ACL is torn, my PCL is torn, my meniscus is ripped. And she said, most of the sports medicine doctors don't want to handle it because it's all a mixed bag of different stuff, because it was a super bad trauma. And the orthopedist said, I can't operate for 6 weeks because your knee's not bending enough. And she's been trying for 6 weeks to do work. And today was her first day, and we mapped. And the primary area came up to her right hand all the way through here. And it feels like, she said, it was all black and blue because I landed on that piece the first time in the area. And we started doing 2 or 3 bone bruises up in here, and her knee bent for 20, 30 degrees. Just
so you fixed a bone bruise in the arm and the knee moved better.
Right, because the body will go into panic mode. And if you have a torn artery or torn ligament, it will protect it. The whole body will protect it. Mm-hmm. So sometimes the knee's stuck, but it may be stuck for something even deeper someplace else in the body. So it's magic. And I am wondering every day. My job is pretty fun. I just put this map out there of what the person shows me. and we pick the primary spot, and it changes everything else in the body. And then we go, okay, what's under that map? And we figure out what tissue it is, and we pick 2 or 3 techniques.
And one of the
And
cool things is when you do it, you can map again and the whole body changes with your map.
Right.
So you're really certain now that, oh, they're going to stand up and be different.
right. And that also transcends psychotherapy. It transcends acupuncture. It transcends Reiki work. If you use the right tool for the right, right hammer for the right tool, then it's going to be profound, and it really helps you hone your skills. And then you can have a theory, and you can put a little bit of energy in it, and the theory didn't work, and you go, well, I fixed 2 other people with that same theory, and then you say, well, I'm going to try something else instead of keep persistently going after that same.
Yeah, it's like that's how you get a therapist, a practitioner with 20 years experience. They test they see something, they test what they think will work, they see the result, and then depending on what happens, they can go with it. And if the next 20 people come in with that same problem, but that thing doesn't work on that one, they can find the next level, the next pattern that works. And then you have a therapist with 20 years experience, as opposed to some therapists, they just kind of like do a little bit of an assessment, and then they do the same thing over and over and over again for 20 years. It's like just anyway, yeah, it's I just love this model and the way this works. And so imtwellnesscenter.com in West Hartford, Connecticut, September 10th to start. And yeah, I will share it. I'm way over here on the West Coast, but I'm going to share it. And
yeah, come to the website. There's an educational button, and there's how to register for the school, how to come to classes. And Ralph, this is our beginning series of how to talk about basic concepts of IMT for the future. But mapping is one of the best tools to use. And the only thing I still suggest is I can give you the thought I could give you this lecture, but it's really put into your hands.
Yeah.
It has to be shown to you once or twice.
And then you get it. Yeah. I remember when you were showing me the little motility, the motion that happens in the body when there's infection. I was just like, can you just show me where it is? Because it was like, what? And then you said, well, here's some right here. And I was like, oh yeah, there it is. And then I started to get it in my hands. So that's a really valuable, it's super valuable.
Yeah, and we don't, I feel that we have to teach touch. We can't talk about touch.
Yeah.
And that experience, because some people have different words for the same experience. So, but if we can all touch it and call this one hot and this one cold, then
we can talk. Yeah.
We can talk. But when you have a concept of hot and cold, do I think you have a flame, or do I think you have a hot plate out of the dishwasher, or do you have an ice cube, or do you have liquid nitrogen to put
Yeah. Well, I'm going to I have a link to our show here in your email, so we can start to share that with your IMT community and our IMT community, and I'm going to share it with the people here in Bellingham. There's a group called Bellingham Healers. There's 1,100 people in that group, so I want to get the word out there. And I used to travel every month somewhere in the U.S. or Canada to learn this stuff. We have a way, Tom has a way to teach it a lot faster now. So anyway, yeah, Tom, this was a great explanation, and just a good overview of what makes integrated manual therapy very unique and powerful. It's basically what I see is like, where's the problem? What kind of problem are you dealing with? And then you have some tools, some that you have from other things, but many from IMT to go make a difference. And then you can recheck, remap, and see, is that problem still there with your hands, with your diagnostics? And then recheck something real, like, is the shoulder better? Is the knee better? And it's how we got that little boy back to walking around and running within a day, really within a few minutes. And the lady getting over headaches and neck pain and back pain after 2 years. And it's like, there's a reason somebody's not healing, and it's about protecting something. And when you can find out what they're protecting them from and make an impact there, they don't need that protection anymore, and you can really heal. So yeah, that was a great explanation.
Well, I'm willing to travel anywhere in the world if somebody would like to feel or touch this with me, and I'd love to show it.
You know
So
what's interesting? When I first met you and Sharon, I instantly that class I said, "Hey, you guys got to come to my office." And then your team was there 4 times a year for many years. So if I'm going to talk to my friends in Bellingham Physical Therapy and see if he wants to bring you guys out. He's talked about this before years ago with the strain counter strain stuff when I showed him some of that. So
yeah,
we're going to get this. We're going to get this on both coasts, man. So
okay,
thank you for
Ralph.
being here. Really appreciate it. And I'll go check all everybody's messages and answer them. I'm going to go ahead and sign us off of this. Oh, and I didn't. All right, you guys. So imtwellnesscenter.com for Tom's class starting September 10th of 2022. If you're listening in Bellingham, Washington, let me know. I'm starting an integrated manual therapy study group.
I remember one time I was having lunch
and this is going to stop this. And
the woman that was
yeah, so reach out to me, Ralph at ralphhavens.com, and I will share this all over the place. Look forward to showing you integrated manual therapy and helping you with your clients. And if you're somebody dealing with a problem, let me know, Ralph at ralphhavens.com, and we can take a look and see what's going on with you. I see people online from all over the world to help them with their healing, and also in town here in Bellingham, Washington. So I'm signing off now, and all the best. Reach out to me if you have any questions or need any support.